We'll try to remember few points with respect to one important concept that is known as febrile seizures. Febrile seizures. So with this letters itself, we can remember few important points with respect to febrile seizures. Febrile seizure is nothing but a baby is having a fever. Along with that, there is a seizure activity. Seizure activity. So do all babies with fever with seizure activity, will you call it as a case of febrile seizure? The answer is no. Why? Because there is a defined age criteria. What is this age criteria is? What is the position of the letter E? It is the fifth letter, right? So fifth letter. The defined age criteria is 6 months to 5 years of age. 6 months to 5 years of age. So do all babies from 6 months to 5 years of age with fever, if the baby is having seizure activity, will you call it as a case of febrile seizure? The answer is no. The baby's brain should have normal development. Baby's brain should have normal development. So there should not be any developmental delay. So developmental milestone delay will be there. So there should not be any developmental delay. That is the next criteria. The next point to remember is that what this I will stand for. I stands for something known as CNS infection. Infection. What is this is? The baby should not have any evidence of CNS infection. So any evidence of CNS infection such as signs of meningitis or encephalitis should not be there. So baby should be free from any CNS infection episode. That is the defined criteria. So how you can define a febrile seizure? A baby from 6 months to 5 years of age with normal brain development without evidence of CNS infection, having a fever with seizure activity, then it will be defined under febrile seizure. Then there are two types, very important types are there. What are these? Simple febrile seizure and complex febrile seizure. So how we can remember the points? Again, we can use this letters, that is I. So I also stands for 1, right? Numerical value 1. So what is that? Is that if the baby is having only one episode, okay, which lasts for less than 15 minutes. So one episode less than 15 minutes within 1 day of fever. Within 1 day of the fever. That the baby is having only one episode of seizure within 15 minutes within 1 day of the fever, that is within 24 hours of the fever, then this is called as simple febrile seizure. Then it is called as simple febrile seizure. Why it is important to know is that if seizure follows this pattern, that only one episode within 15 minutes and within 1 day of the fever, then we call it as a case of simple febrile seizure, and it is having no risk of epilepsy in near future. That the baby is not having any epilepsy in near future. If it crosses this, okay, if it crosses this, that is more than 15 minutes, the seizure lasts. There are more than one episode, and the baby is having seizure activity not only within 1 day, he is having seizure activity second day, third day, fourth day and all. So if the baby is having fever activity for more than first day, then it will be called as complex febrile seizure. Complex febrile seizure, and it is having increased risk of epilepsy. Epilepsy risk is present. So these are the important points, that fever with seizure activity from 6 months to 5 years of age, brain development is completely normal, there is no evidence of CNS infection, and there are two types, simple and complex. So few more points we can remember, that is that if you reverse this E, okay, if you reverse this E, what you get is 3. So there is an day defined, that 3 days. What is this? Is that from the fever for the next 3 days. So 0th day to 3 days of the fever episode. Okay, if you give one drug to prevent seizure activity, so baby is having fever today, what you can give one drug. Okay, by giving the drug, you are preventing expected seizure activity in a baby for the next 3 days. So if that procedure is known as intermittent prophylaxis. So which drug is given? The drug is clobazam. Clobazam in Indian setup. Clobazam in Indian setup. So clobazam is a part of intermittent prophylaxis from 0th day of the fever till 3 days. It is given to avoid the expected seizure activity. It is known as intermittent prophylaxis. So do all babies with fever will give this? No. There is a defined criteria. What is that? Is that there are 3 important defined criteria. If the baby is having a family history, so there is a family history of febrile seizure. So in that case, you can consider this intermittent prophylaxis. Next, the baby is having one important point to remember is that recurrent febrile seizure. So what is this recurrent febrile seizure? Is that more than 3 episodes of febrile seizure activity in the last 6 months. In the last 6 months, that is more than 3 episodes in the last 6 months. If it is present, then you can consider this prophylaxis known as intermittent prophylaxis with clobazam. So the baby, if the baby is having family history, then more than 3 episodes in the last 6 months. One more point is that if the baby's febrile seizure activity started within less than 18 months. So within the 18 months of the age, if the baby starts getting febrile seizure activity, then intermittent prophylaxis can be considered. So these are the important points with respect to febrile seizure we can remember. So quickly I will try to revise everything. So febrile seizure, that is fever with seizure activity. The defined age criteria is that the 6 months to 5 years of age, and the baby's brain development is completely normal, and there should not be any evidence of CNS infection. So then only this criteria is defined. Febrile seizure criteria is defined. There are 2 important types are there: simple febrile seizure and complex febrile seizure. Simple is less than 1 day of the fever or 24 hours, and it lasts for what? Less than 15 minutes, and there is only 1 episode. The point to remember is that it is a simple with no risk of epilepsy in near future, and the complex is defined as more than 15 minutes, more than 1 episode, more than first day, then we will call it as a case of complex febrile seizure. Next point to remember is that there is something known as intermittent prophylaxis from 0th day till 3 days. Next, there is a family history, recurrent episode is there. Next, less than 18 months of the age, if the febrile seizure activity starts. Recurrent is defined as more than 3 episodes within the last 6 months. It is known as recurrent febrile seizure. So in that case, you can refer this something known as recurrent intermittent prophylaxis. Thank you.